Welcome to Partners for Advancing Health Equity, a podcast bringing together people working on the forefront of addressing issues of health justice. Here, we create a space for in-depth conversations about what it will take to create the conditions that allow all people to live their healthiest life possible.
Welcome to the Partners for Advancing Health Equity podcast. I'm your host, Karen Bell. I'm thrilled to have you join us for this episode as we delve into the importance of prioritizing mental and emotional well-being, which we know is necessary to maintain endurance in health equity work. Given our current times, it is critical that health equity advocates learn to adapt, grow, or pivot when resources and support for our work are strained or threatened. This episode is part of our quarterly learning journey, a dynamic series designed to equip individuals and organizations with comprehensive insights and tools to drive meaningful progress in health equity. Each quarter, we focus on a specific topic, offering a series of learning engagements curated to enhance knowledge and skills. Our objectives are simple but powerful: to engage, to inform, and to inspire. We aim to create a space where you can learn from thought leaders, discover new perspectives, and identify how you can contribute to shaping a healthier, more equitable future for all. Last year, we focused on methods for building collective resiliency and trust. We explored topics such as civic engagement, misinformation, organizational change, and equitable resource distribution. This year, our focus will build on that foundation by centering community care, adaptability, capacity building, and sustainability to support endurance in our work. Today's episode begins our look at the complex ways in which our mental and emotional well-being shapes our ability to do health equity work effectively. We will uplift voices from our past learnings that speak to mental wellness and what is needed to keep the work going. Through these voices, we will cover 4 overarching themes that arise from our past conversations: community care and emotional safety, adaptability and capacity building, sustainability and long-term investment, and overcoming threats and collective action. To kick off today's episode, here's a thought-provoking quote from Brett Ford, Associate Professor of Psychology at the University of Toronto and a leader in this space.
There's so many missed opportunities for thriving and for growth that can happen, right? Life isn't just about avoiding depression, anxiety, and loneliness. It's also about, opportunities to connect and to feel well, to feel wellness, not just a lack of illness.
This quote reminds us that true wellness involves actively seeking connections and growth, rather than merely avoiding negative emotions that can bring us down. In other words, endurance is fostered by supportive networks, cross-sector collaboration, ongoing learning, and a shared vision for systemic change. We begin this retrospective where endurance often starts, with community and emotional safety, the foundations for sustaining ourselves and our work. These voices remind us that connection, vulnerability, and mutual support are essential for lasting impact.
In the midst of our grief and panic and fear, we feel that connection to one another, which I think so often is something that we lack, that just connecting to one another on we're just trying to get through this together.
We want to get to the roots in mental health, but I also want you to feel comfortable with how you're feeling, realize that it's okay, and realize that you're deserving of these things.
I want people to feel empowered to say how they're feeling, say what they need from their support system, ask for support. I want them to feel like it's okay to be vulnerable and say, you know what, today is not a good day for me. I cannot be what you need me to be today. As a matter of fact, I need some support today. When we are in a period of crisis, whether it's an individual crisis or community crisis, we have to extend grace to others and know that they're not operating at their best, highest level. And we probably aren't either.
This sense of connection doesn't stop at personal support, but it also extends into how we show up collectively. In a later webinar, Myra Alvarez, president of the Children's Partnership, speaks specifically to the correlation of civic engagement and mental health.
I think there's something to be said about the connection between civic engagement and participation and mental health. The ability to enact change and believe in the power of our voice and our ability to contribute is a mental health intervention. It's not only this opportunity to impact your community well-being, it's frankly an opportunity to impact your individual well-being.
Endurance also depends on what and who we choose to invest in. It's important to remember that endurance also means adapting and building capacity together. As we face new challenges, we have to remember that advocacy, collaboration, and investment in community efforts and leadership are key.
We have to learn how to advocate for ourselves and not take for granted that government is going to do that for us or that a physician is going to do that for us.
It takes an ecosystem of organizations in communities that are most impacted. How can we make forward movement in ways that make sense for us as individuals, as organizations, and be in greater solidarity or in some kind of united front?
There's training and capacity building at every level that we can do to advance this work and think about how we build those bridges. And it's one of the roles that I think philanthropy can play because they sit at the intersection of all of these sectors, of community, of academia, of government, of all of these places. So how do we foster more of those bridges?
I think it's important that you taking the time to build the relationships within the community and then funding for infrastructure building. Because oftentimes we don't necessarily have the infrastructure within the communities to have these relationships, to then, develop programs, to implement those programs, to evaluate those programs that actually improve people's lives.
How do we make sure that community is driving, defining those conditions for health and well-being? How do we make sure that while we're intervening at the system level, the impact is felt at the community level?
Communities who have been most harmed have come up with solutions, pretty powerful ones, in the face of this great harm.
It is going to be incumbent upon those of us in communities who are doing work now more than ever to make sure that the needs of communities are met. We're going to have to go back and to continue to rely on that community wisdom.
We also know that sustaining health equity work requires a dedicated investment in individuals, organizations, initiatives, and ecosystems that are committed to promoting and maintaining health equity work over the long term.
And we have this ecosystem, very dynamic ecosystem of community-based organizations that are doing some of the most innovative things that I have ever seen. They have great challenges, but they also have great promise. We need to make sure that we're devoting sufficient resources to helping these types of organizations to have the capacity to manage the grants effectively. It's creating institutions that are impactful, and sustainable, things that will be able to continue to function even beyond your time in office. But not only building institutions, but taking and bringing institutions together and bringing those resources together from institutions to be able to have an impact on health.
Since the pandemic, people are struggling. People are oversaturated and overwhelmed with the number of issues that are in our face all the time. What can we do to acknowledge that and then to invest in impact work that is going to be a compounded effort of all the things that you've been doing for a long time? Community-based organizations are the people who are sticking around. These people are actually living, in their community. It's them, their family, their community that's all being impacted. That's the sustainability. Invest in them.
We can change how the process and how this work is done so that the resources can get to the people who are doing the work on the ground to heal our communities in a sustainable and lasting way so that we can have thriving existences rather than constantly being focused on fixing what's broken.
Finally, it is important to acknowledge that endurance is also about overcoming threats and building power together. As we face adversity, unity and collective action are our greatest strengths.
We have to become more self-reliant on the wisdom and knowledge that's in communities to be able to build the incremental changes that we're talking about. But most importantly, we have to understand what the game is, because right now it is a game.
Remember, the power of the people it still exists, and we still hold that power. We cannot abdicate our power to those in position, because those in position are there temporarily.
We need to be fighting for health equity across all the movements, because the unity is one of the things that's going to give us the momentum and the power that we need.
Organizing brings those people together, builds relationships among them. And by doing that, I think it reveals that those people aren't facing just individual problems that are the result of their own, problems, their own issues. They're not to blame for those things, but there are these bigger problems, systemic problems.
As we wrap up these conversations, I want to end with a positive message from Alma Stewart Allen, founder and president of the Louisiana Center for Health Equity. She encourages us all to keep moving toward action in the face of adversity.
I just would like to encourage everyone to, seize the opportunities. We can focus on the negatives and the doom and gloom and what we want, the way we want things to be, or we can focus on the realities of what we have and the way that it is. And we can make the adjustment on our part, on our end, to navigate this environment, this current environment, and to still have some gains and make progress even within this environment that we're in. So my words to everyone is, don't give up. Don't lay down. Don't be discouraged. In fact, this should be more motivating and encourage you. This is a call to action. This means get up, show up, and stand up. Speak up. Do your part. And we will see progress even within this current environment.
As we've heard, prioritizing mental and emotional well-being for endurance and health equity work is not just about persistence. It's about community care, adaptability, and collective action. We hope these voices and resources inspire you to keep moving forward, supporting one another, and building a more equitable future. For a deeper exploration of the topics covered, you can find links to resources in the episode overview on podcast platforms. We also want to give you, our listeners, the opportunity to amplify the work that you are doing in the health equity space. You can submit to our resource library on our website. And we are always looking for guest blog authors and panelists for future activities. In the overview copy for this episode, you will find links to contribute if you're interested. And as always, we'd love to hear your thoughts, so leave a comment and be sure to follow us so you don't miss the next episode. Thanks for listening.
Thank you for joining us for this episode of Partners for Advancing Health Equity. Be sure to visit our website and become a member of our collaborative at partnersforhealthequity.org. That's partners, 4, healthequity.org. Follow us on your favorite social media platforms, and be sure to subscribe wherever you enjoy your podcasts. Partners for Advancing Health Equity is led by Tulane University Celia Scott Weatherhead School of Public Health and Tropical Medicine, is part of the Tulane Health Equity Institute, and is supported by a grant from the Robert Wood Johnson Foundation. Until next time.